Hi, how you guys doing? My name is Jacob Melgar. I'm here at our Synergy Medical Group Chula Vista clinic, and we're here to talk about BFR today. Demonstrating BFR with me today will be Natasha Hastings, who is our head physical therapist here, as well as our clinical director. So a little bit of information about what BFR is. BFR stands for Blood Flow Restriction Therapy. It's a new modality that's just come out that we have here at Synergy that allows us to build bigger muscles without loading the joint as heavily as you would usually do at the gym. So say we have a weight bearing precaution by our doctor and we're not able to actually put a lot of weight on the leg, we can still build muscle and work around that injury utilizing BFR without loading the joint so much. So what we're going to have Natasha do here is we're going to have her do some squats. Natasha's 1 rep max is at 160. However, we're going to give Natasha the same adaptations and the same muscle building capability, but she's only going to be working at 60 pounds. So her 1RM is 160, and now we're going to reduce it down to 60, and she's going to get the same changes. So I'm going to come over here, and I'm going to inflate the cuff, and while she leg presses, we're going to have her do 30 repetitions.
Getting a little tight, but that's normal.
So what's happening now is the blood pressure cuff is actually inflating and cutting off a certain percentage of the blood. It's not totally occluding the blood, but it's creating an environment in which the blood is not being able to return back to the heart, and the muscles are feeling the metabolic stress, and they're actually going to start growing during the session.
I'm just doing my first set to 30, so I'm counting in my head to 30.
So she'll originally do 30 first. After that, she'll do 3 other sets of 15 with 30 to 60 second breaks. The great thing about BFR is that it's a very quick workout. It's usually around 20 minutes, and you'll get the same adaptations that you would usually get at the gym, but here we are working at a much less load. So if you were here for 2 sessions a week for 6 weeks, we would potentially have you do it twice a week, depending on what the extremity is. It could be either the upper arms if you're having a debridement of your shoulder, or if you're coming a post-op ACL and you're not allowed to weight bear, we can have you do some exercises that you won't be weight bearing, but again, we'll actually be getting bigger muscles without having to load the joint or having to even put our feet on the ground. We're having Natasha do her 3rd set of 15, and the muscle is swelling a lot because the blood is not allowed to return fully, but that's again increasing the stress on the muscle, but the load is still at 20 to 30% of what Natasha would generally be doing. So the load is only right now at 60 pounds. Her 1 rep max is 60, so she's still getting the same adaptations without loading the joint so much, or without even necessarily having to put her joint through so much stress. So a little information on what the actual unit is doing. So as we can see here, the unit is live time occluding the blood pressure at 80% of what total occlusion would be considered. So it's live feedback of what is actually happening. So as Natasha extends her knee, you can see it decrease and increase. So it's always reading your blood pressure, so that way you're always getting the direct amount of occlusion that you need in order to gain bigger muscle without loading the joint.
And then patients can also go as slow as they want. There's a timer on here. And then it's nice because the patients can then have control. When they do their 15 reps, they can hit this little circle area in here which stops it and gives them the 30-second rest break. But I just did my 3 sets of 15, so typically the patient starts out with 30 reps, and then they'll do 3 sets of 15 with 30-second rest breaks in between. So I'm done with those, and now it's deflating, and we'll go on to my next exercise. But you could typically do like 2 to 3, 4 exercises per area. So I'll go do like 2 or 3 more with my legs, and then I can move on to my arms or whatnot.
To further drive the idea that BFR is a very good modality for patients who can't bear weight, we don't necessarily have to have our feet on the ground if we want to get stronger legs. To show this, we're going to have Natasha do standing hip abductions, which is going to work our side glute muscle and our legs, and the cuff is going to be inflated right here. And once we get it inflated, again, we're going to occlude the pressure at 80% of what total occlusion would be, and Natasha's still going to get the same adaptations as if she was doing an exercise that required her to actually plant her feet on the ground. She's getting bigger muscles without even having to put her feet on the ground, because we're inducing a stress response to the muscles.
So I am standing and doing this standing, but you could do this lying down on the table, like say a patient can't even stand. So you could do straight leg raises, flexion, abduction, extension. There's like a world of possibilities, but this is just one way. Like I'm not weight bearing on this leg right now.
Just because you're on a weight-bearing restriction, it doesn't necessarily mean that we can't build muscle and work around your injury.